My name is Dr. Nicole Pisapia, and I'm a gastroenterologist here at Cookeville Regional Medical Center. So gastroenterology is basically the study of and the look at the whole gastrointestinal tract, basically from the mouth all the way down to the rectum and all of the internal organs within the abdominal cavity. So when I started in 2019, we brought endoscopic ultrasound here because I was trained in that procedure, and so I'm the only physician in the Upper Cumberland who's performing endoscopic ultrasound. So many of those procedures can just stay here now, and we don't have to refer patients out to Nashville or Knoxville for that procedure now. So endoscopic ultrasound, or EUS, is basically a type of endoscopic procedure where we go into the abdominal cavity either through the mouth or up through the rectum, depending on what we're trying to look at. And we not only have the camera and the light like a regular endoscope, but we have the ability to turn an ultrasound on. And the point of that is to look beyond the wall and beyond the cavity that we're in, and it looks at the structures that sit around that area. For instance, if we go through the mouth, we can look at the esophagus and what's outside of it. We can look beneath the wall of the stomach, and very commonly we look at the pancreas, and that's one of the most common reasons I get asked to do that procedure or see patients for that procedure, is to look at the pancreas to see if there's masses in the pancreas, tumors, problems with pancreatitis, or drainage ducts that are a little bit too big and things like that. So it's basically like an ultrasound that you'd get over the abdomen, like many people have had, like for instance, when you're pregnant, you get an ultrasound, but it's from a camera within the abdominal cavity. So you get really close to the organ and you can get really good and detailed pictures. And you can also take samples with a biopsy needle if need be.